This is episode 31 of Hands on Health, the podcast all about living your healthiest life on the coast. I'm your host, Felicia Struve. My guest today is Donna Bisdell. Donna is an occupational therapist and manager of CMH Rehabilitation Services. I've known Donna for about 10 years, and she is one of the most compassionate and talented clinicians I've had the privilege to meet. Occupational therapy focuses on helping people do the activities of daily living more successfully. That might be something like brushing your teeth after a stroke, or thriving in school with a learning disability. Donna gives us a closer look at occupational therapy. Welcome, and thanks for joining me for another episode of Hands on Health. I am joined today by Donna Bisdell, who is the manager of rehabilitation services at Columbia Memorial Hospital. And that actually covers quite a number of different services. Donna, do you want to share with us what rehabilitation services means?
So rehabilitation in our sense means occupational, physical, and speech therapy. We also had massage under that umbrella, and we have athletic trainers under that umbrella. So those are the disciplines that I manage.
And you are, by profession, an occupational therapist.
Correct. Yes.
So up until about 10 years ago, I hadn't even heard of occupational therapy, and I had no idea what it meant. Mm-hmm. Can you explain for our listeners what occupational therapy is and how you help?
Sure. So occupational therapy, it's a pretty dynamic field, and it's broad because we work with folks from infant all the way up to maturity and a variety of diagnosis. In some places, there's a lot of similarities between PT and OT. You know, we do exercises, but we're looking at the broader scheme of things. We look at the activities of daily living. We look at the full body, the emotional, the cognition, the vision, and physical, right? So we get a nice, clear picture of the person and what are their strengths and what are their limitations to be able to engage in all the activities they want to do in life. So with kids, we look at school, we look at play, we look at learning. If something is hindering their function, we use different modalities, different tools to be able to help them sit at a classroom desk, help them play with their neighbors down the street. And so we might use exercises to strengthen their body because they can't sit in a chair to look at the board, right? So we're going to do things that are related to, when we're talking about pediatrics, to their age range, right? So play and providing the play that strengthens the legs, the arms, the core, we're going to do that. Climbing, rolling, running, and then engaging in activities. When we're talking about older folks, we look at their work. What kind of work do they do? Do they take care of children? Can they manage their home? Can they get out in the community and go to the grocery store? Is it a cognitive issue where we need to help them learn strategies to be able to approach the grocery store and know how to get their groceries? Is it a range of motion issue that we're going to work on activities that are promoting them moving in a normal fashion? So, you know, OT looks at the whole gamut. I mean, we do pre-driver screenings, we do work site assessments, home assessments. So it's very broad. We work in acute care, outpatient, inpatient. We work at home health. We'll work in psychiatric clinics. We'll work in doctors' offices. We make splints. So you name it. And, you know, some people specialize and some people are generalists. And you can specialize in any one of those things. We have hand therapists, but a hand therapist could also be a physical therapist. So that's a very special process and the learning is whoever goes into hand therapy. So you would be an OT first, and then you would specialize in hands, or you'd be a PT first, and then you would specialize in hands. So
Okay. That would be like a doctor, a primary care doctor could come from a doctor of osteopathy training or from a medical doctor training.
right. Yeah.
And but still offer similar services, but with a different philosophy behind it.
Right. And that's it. It's the focus, right, of the specialty. So when you're talking about peds, we have ped specialists. So, or you could have general, I'm an OT. I have gone to school for my amount to get my bachelor's. And so throughout the years, I've worked with pediatrics. I don't have to get a certification to work with peds. I can still do that because I understand the development, I understand the process. But if I chose that to be my main focus, there's even within that group, you can have various certifications that you're going to specialize with these children. I'm just going to do feeding with these children. I'm just going to work on their sensory system with these children. And the same thing with adults. You could get certification for hands. So now all you're going to really work with are hands, maybe elbows, possibly shoulders, but the upper extremity. And that is a certification. You need to be a certified hand therapist, but as an OT, I can work with hands because I know the biomechanics, I know the function of a hand and how to bring function back to injured hands, things like that. But again, yes, it's very broad, but you can pinpoint the specialty you want to be in. I'm more of a generalist, but I've had a lot of experience with pediatrics and a lot with the work community for injured workers program. So those are the two things I like to do, and I have done a lot in the past. But also neuro patients is a strong one for me because I've worked in traumatic brain injury for many years.
So neuro patients might include people who've like been in an accident or a fall or perhaps a stroke.
Stroke, yep. Parkinson's is also any of those, any autoimmune kind of thing that interferes with the neurology of the system, of the body, of the brain, of the eyes. Yeah.
Well, and I think it would be good to help listeners sort of visualize what going to occupational therapy is like, to describe the environment. There might be some of our listeners who have actually encountered you outside of CMH, and prior to CMH, you had your own practice, your private practice.
Mm-hmm.
And I remember your gym had
Mm-hmm.
everything from swings to rope ladders to trampolines and what am I thinking? There's you had scooters, you had all these,
Mm-hmm.
a child's desk, you had all of these things that a child could engage with and do those play activities and fine motor activities. But then you also had a kitchen.
Mm-hmm.
And so that makes me think of folks who've had neurocognitive issues that need to work on how do I cook? How do I stand at the stove? How do I reach up to the cupboard? So there were a lot of different environments that
Mm-hmm.
that you work within and help people to be able
Right.
to use again.
Yeah. So, I mean, in general, when you're talking about occupational therapy, you're talking about activities of daily living or higher level cognitive, executive functioning types of training. So, as an adult, we have a responsibility to take care of our finances, to organize our day, to be able to get to work and do those job processes of multitasking and organizing and stuff like that. So, to the basics of self care, just being able to put your socks on.
Mm-hmm.
So, when I had my business, because we saw a variety of patients, but mostly children and work injured clients, but we also had a part in the back that was catered more towards hand injuries and treatment room type things for general issues. So anytime you come into an OT, you're going to see stuff. You're going to see uh, like pegboards or climbing gyms or a kitchen, because a kitchen, you can use a kitchen for lots of different things. There might be somebody that had a stroke and they have a visual cut. So I want to help them be able to get back in the kitchen and cook the meal for their family, right? So I have to help them learn visual skills to be able to see their environment. So the kitchen's a great place, right? There's lots of stuff in the kitchen. You got stuff in the cabinets. Are they able to learn how to scan their environment, find the things they need? Um, so I would do an activity that would involve them using their visual skills or their cognitive skills or their physical skills that are limiting, right? To either cook a meal, to find things, to prepare for a meal, to clean up after a meal, because all of those do two things. One, they show you what they can do, and it shows you what they can't do. So when you look at somebody that has a stroke, they might have a hemiparesis, so half of their body is not functioning like it used to. And so using the kitchen, you can do a lot of things, and it's a functional activity, right? It's an activity that you or I would do, anybody would have to do. Now, if they didn't have to be in the kitchen, they never cooked in their life, we probably wouldn't do that. But we would do something like work on their self-care, or maybe they do all the grocery shopping. That's it. We would go out to the grocery store. So we do a lot of community kind of things as well, because we want them to be able to reach their highest level of independence with the things they want to do and they need to do. And that's what happens with any kind of illness or trauma, or even if you think about psychologically, any kind of anxiety, stress, it impedes our ability to engage in our tasks and takes us out. So we use skills to bring them back in, and we help them understand how they can do things. And it's amazing when you can show somebody, even just adapting an environment or giving them a piece of equipment that allows them to reach the things in their upper cabinet or put on their sock, or be able to just organize them enough that they can focus on the paperwork that they need to do, and now they're successful. Once you've reached that success, people take off. They have a sense of purpose and hope that they can move forward. So those functional activities are the key to an occupational therapy session, because that's what's meaningful to them. That's what they want to do when they're all done and said, you know. And we do the basic stuff, basic hand exercises, like for adults or peds. If we need them to write, yeah, we have to do some things that are more just physically based exercises and things, but that's not the core of what their sessions will look like. But any clinic, you're going to have gadgets, you're going to have functional types of activities that they'll do throughout their session.
Hey there, it's Felicia. Thanks for listening. I'd love to include your questions or comments in an upcoming episode. To leave me a message, please call 503-338-4654. If you've got a health question, I'll do my best to get you an expert answer. Again, that number is 503-338-4654. Now let's get back to our guest. So how long does a session last, and how long does the therapy process often last? Is there kind of a range of time?
It depends on where you are and where you work. So if you go to an inpatient facility, so you've had a hip surgery and you're admitted to the hospital, you're going to have occupational and physical therapy. So those sessions are anywhere from 15 to 45 minutes, depending on what else is happening on the floor. The floor, you have a lot of people that want to get in and see them, and they're only there for a short period of time. So we want to make sure that they're as safe as possible so that they can move on to the next step at home. So it's a little different in inpatient. But usually you'll see them several times a day to make sure you're addressing all the things that they need to do to go home. So those sessions are short, usually an outpatient, and it depends on the type of clinic. If it's more of an orthopedic clinic, like a hand, elbow kind of thing, and that's all they see, they'll usually do a 30 to 45-minute session. In our outpatient and some of the other ones, I know my clinic, we tried to do hour treatments, and that's because the 30 minutes is good after they've been down the road a little bit and they're at a certain point. But initially, there's a lot to learn about the patient, to understand the direction we need to go. And so we generally use the full hour, but it could be anywhere from 45 to an hour. But I would say across the country, if you're looking at it, it's probably 30 to 45 minutes is the average time. Pediatric clinics, usually they'll do evaluations that are up to an hour and a half to 2 hours because there's a lot of paperwork that's involved in that. If you do any kind of work programs, you could be in a facility from 2 hours to 8 hours, depending on
Wow.
what types of things you're doing with them and types of evaluations you need to get them back to work. It's kind of like their work, right? So when you're injured on the job, sometimes after they've gone through their acute injury rehab, they're at a level where they're not quite ready to go back to work. So they still need work, but they don't need that acute rehab, but they need more training and that. So you can set up work programs that they start out at 2 hours and build up to 8 hours and get their endurance up to the point where they can go back to work. Sometimes it's 5 days a week, sometimes it's 3 days a week. So there's a lot of different types of work programs too. So as far as the duration, I would say anywhere from 4 to 12 weeks with most of the basic orthopedic type of things. When you're talking more of the neuro patients that have more intensive needs for rehab, they could be here 3 to 6 months, if not longer. A lot of the kids you're going to see pretty intensely at the beginning and could see them up for a couple years, depending on what their needs are. It might not be consistently throughout those couple years, but even the first year, it might be once a week. Might start it out twice and be once a week for the rest of the year. Might be every other month, but it just depends on the needs and how they're progressing. And it also depends on insurance too, unfortunately.
Yeah. Yeah. With most of our healthcare
Yeah,
decisions, there is always
yeah.
that financial piece too. Well, it makes sense that physical, like you said, the orthopedic needs are going to be shorter in duration than say kids who are changing as they go through the therapy. So if you've got a kid who's got some sensory, you mentioned sensory troubles, which they've got sensory troubles that pops up in different ways over their development. So
Yeah, and it changes, right? And
mhm.
so that's why it's kind of nice in the sense that when you have those types of conditions that you're working on, is to really be able to do that intensity for at least the first year and then have that ability to address it as they move forward because it will change. We're going to hope that the foundation is laid down, that they learn some coping and integrative skills that will keep them on the right track to do school, to take care of themselves, to develop in the way that they need to have a good quality life, right? But there might need to be a 3-month stint where you kind of bring them back and get the issues that are happening now that they're a little older and they're doing other things that are more challenging.
Mhm.
but the base level is there, so you can pull from that. You just might need different tools to get there so that sensory wise they're regulated and able to handle whatever they need to face.
Well, or even I'm thinking about like a kid who has ADHD, for example, at 6 years
Mm-hmm.
old, they need to develop those skills of calming enough to sit in class,
Mm-hmm.
whereas when they're 12 years old, now they need the executive functioning skills
Mm-hmm.
of,
Right.
I heard the teacher say what my homework is, I'm going to write it down. And when I get home, I have a certain time that I work on it. I know where I put it in my backpack. And those are a whole different set of skills than what that 6-year-old needed to cope with their ADHD. So,
Right. Exactly. Yeah, exactly.
well, what do you find rewarding about your work with patients and being an occupational therapist?
Well, it's always been that ability to see somebody reach their goals, right? You know, we can give all kind of exercises, we can give all kind of recommendations, but I really believe that our role is to be that vessel for a short time to help that person understand what they can do and how they can move forward. And when you make that connection with somebody and they know you get it, and I get them, they get me, and we can move forward with our plan of care, because it is really important that the patient is a part of that plan of care. We can't be separate from it. And so you get really intimate with these people about what they want, at least emotionally, you can. So, really trying to understand them. And then that day comes when they're at that point where they're doing what they want to do and they're excited about it. And I love that. And I know that I have been a part of that success. And I love to see that. And even if they don't get everything they want, if there's one or two things that they're able to do better now, it's amazing the attitude change you can have with people and help them. And eventually they can do it on their own. When someone is empowered enough to be able to continue their progress, that too is pretty exciting. I mean, I love that about, and what I love about my profession is that it's a very creative profession, and I love people. So, getting involved with people and really, really being able to help them and be in a quality life is, you couldn't ask for anything more.
Yeah. Well, just in the spirit of full disclosure, my family has worked with Donna before, and we always looked forward to going to therapy sessions. It's a fun thing to do, and the confidence that they build when it's when you're in therapy, it makes a difference in
Yeah.
life. I mean, it's one of those things where you spend an hour with somebody like Donna, and the rest of your week, it's like, I can do this now. It works. It's really
Yeah.
amazing how
Yeah.
impactful it can be.
Yeah. Well,
So
that's good. Yeah. And that's the other part is, you know, I'm actually from the East Coast. So when I started here on the West Coast and started seeing patients, I don't have that history to see somebody on the street. But I'm at a point now where I've worked with kids, they were 6 years old and now they're graduating high school. And so and to see them and see the success and watch these kids just really thrive, it is so incredible to me. Or a patient that I worked with and they're using their hand again, and or whatever, they're back to work. It is so fun to see that down the road
yeah,
too. Yeah.
yeah. Well, you've made a difference in our family's life. So I'm sure that there are a lot of people out there who could say the same. So thank you for joining me and helping to explain what occupational therapy is for our listeners. Because, like I said, for me, I didn't know anything about it until about 10 years ago. And I think it is such a vital piece of our our healthcare system, and a lot of people don't know about it till they need it. And
yeah, right.
And sometimes you need to ask for it too. When you're with your doctor and you're struggling, you may not think to say, I'm really having a hard time getting up the stairs, or I'm having a hard time organizing myself to be able to get the kids out the door and the da-da-da-da-da. I should have enough time, but I can't,
Yeah,
So
right. Yeah.
ask for help and maybe you'll get Donna.
Yeah.
Thank you for joining us today. I'm Felicia Struve, and this has been an episode of Hands on Health, brought to you by Columbia Memorial Hospital.